Hi, I'm Gary Bebow, CEO of White River Health System, and this is my October CEO Connection. I'm really pleased today to have Dr. Doug Bernard with me. Dr. Bernard has been our Chief Medical Officer since 2012 on a part-time basis, and then became full-time in August of 2015. And so, it's been so important for us to have a Chief Medical Officer that he does a wonderful job of communicating administrative policies and strategic plans with the medical staff, and it's just it's a great thing for our organization to have that conduit between administration and the medical staff. So, and boy, Dr. Bernard's done a wonderful job in playing that role. So, but today we're gonna talk about a policy that we're about to implement at White River Health System regarding mandatory flu shots for all employees of the system. Obviously, the purpose of the mandatory flu shots is so that we can assure patients and our employees and families that this is as healthy an environment as we possibly can have. So as individuals come here and are treated, that they can have assurance that we're concerned with that. So with that, Dr. Bernard, I know that you've done a lot of research in terms of flu shots and why it really does make sense for us to do that and why it's consistent with our mission. Why don't you talk a little bit about flu shots?
Well, and thank you. We have talked about a mandatory flu vaccine for years, and actually it was employee-driven. I chair the Infection Prevention Committee, and which is made up of nursing and our plant managers. Everybody thought that this was a good idea for the past few years, and we started researching other hospitals, and so we are not the only hospital in the state. Baptist, for example, Children's Hospital, they have a mandatory flu vaccine program. Interestingly enough, there are many other hospitals throughout the country that also have a mandatory.
It's almost become a standard, isn't it?
It almost is, and the reason is exactly what you said. We have 200,000 to 300,000 people a year are hospitalized with the flu. And out of those 200,000 or 300,000 people, 36,000 people, at least this is back in 2014, died. And there are many people who are at high risk for death, especially people who have COPD, diabetes, heart disease, the same people that we have that are in our hospital. And so these hospitals felt like if we're going to really show our patients that we care and live our mission, then we, as not only physicians and nurses, but also everybody who walks the halls of this hospital those hospitals should be vaccinated. And again, because it takes 2 or 3 days, up to 2 days, for you to feel the signs and symptoms of the flu once you're exposed. And then once you are exposed, you can carry that virus for 7 days. If somebody gets sick, well, they've already had 2 or 3 days in the hospital where they've exposed people. So it's very important to get that done early, and it is becoming a national standard. The CDC has made a strong statement that they strongly recommend every hospital have a mandatory flu policy, even though they can't mandate that, but they strongly recommend, and this has been going on nationwide for over 5 years now.
There's been some concern in the past that getting a flu shot leads to have you get the flu, but that's the old day of when you had a live bug given, and today this flu shot is really safe, isn't it?
Sure. They have a couple different strains. They have the stuff that the flu vaccine we use at White River is going to be what's called a killed virus. So you cannot get the flu from a killed virus. They have an attenuated virus, which is a nasal spray, which we don't offer. And that nasal spray is really given to people who want it. It's restricted to a certain age, and in fact, we just don't even offer it here. But you cannot get the flu from a flu vaccine. Now, some people will get mild soreness, maybe a low-grade fever, but nothing major. And of course, there's always the extreme reaction where somebody can have an adverse reaction, but that would be incredibly rare. And that's exactly what the literature says as well.
Yeah, I really appreciate you coming and talking about that today. The policy does provide some exceptions.
It does.
In those rare circumstances where an individual can't have the flu shot, and so we've provided some exceptions for that, but for the most part, we're expecting to have pretty much 100% compliance with everyone taking the flu taking the flu shot.
The studies show that when it was just a recommended flu vaccine, that most hospitals, most healthcare facilities never got above 70%, and that's about where we were last year. we need to be well above that, and we know there's going to be some exceptions, and we understand that, and we certainly respect that.
Yeah, thanks. I want to be sure that all employees get a copy of the policy that's to be implemented, so they clearly understand what it says, and if there are exceptions, if they can meet those. But for the most part, the positive thing here is that this health system is taking a proactive role to create an environment that's safe for patients and our staff and our families. So I appreciate your leadership here.
You bet. I just want to add, there's always a question that comes up with pregnancy, and pregnancy, that is most important that you get a flu vaccine during pregnancy, because that you are actually compromised when you're pregnant, and that vaccine passes on to your child as well, your unborn child. So it's very important to protect you, yourself, and your family. So
thanks, Doc. Thanks for coming.
You're welcome.
Thank you.
You're welcome.
We have 2 employees of the month to recognize. At Stone County Medical Center, Melissa Rennie, an RN in the nursing department, has been recognized as their employee of the month for positive demeanor in all aspects of her work. At White River Medical Center, Sandy Willite, an LPN at our Melbourne Medical Clinic, has been recognized. Sandy's been an employee with us for 5 years, and she's Employee of the Month representing Involved. If you see Melissa and Sandy, be sure to congratulate them for receiving this Employee of the Month award. So great job. I want to welcome 2 new providers to the health system. Stranger to none of us, Ellen Qualls is now an APRN as part of our hospitalist program. Gosh, when I came to Batesville back 26 years ago, Ellen was well known then in the nursing profession, and over the years she was the head of our ICU department, went on and got her education, and she just brings to us a whole lot of experience, and people really respect Ellen and her work ethic and her skills. So welcome Ellen back to the hospital as part of our hospitals program. Diana Jacob is a physician, an internal medicine physician who has joined our hospitalist program as well. So you see Dr. Jacob and Ellen, be sure to welcome them aboard. Our friends at John 3:16 wants to recognize White River Medical Center employees by having a fish fry at our campus. The date will be October 11th, and from 11 o'clock in the morning to 1 o'clock in the afternoon, and from 6 o'clock at night to 8 o'clock at night, they will be set up to provide our White River Medical Center employees a fish fry. And so they'll be at the east entrance, and John 3:16's been great partners with us in providing services and manpower services in our laundry, and just over the years we've really had a great relationship with them. And so in return for their respect for us, they want to offer us a fish fry. And so come on out and enjoy the free meal from John 3:16. Our annual Health First event is on October 17th from 4 o'clock to 7 o'clock at the Batesville Community and Aquatic Center. This is our annual event that we showcase our healthcare services to women in our surrounding area. It's a partnership with First Community Bank, and I know that all of us really respect and appreciate First Community Bank and what they do to make us a better healthcare system and enhance our community. So I hope on October the 17th, if you have an opportunity from 4 to 7, you'll come on over to the Batesville Aquatic Center and participate with us. October is Breast Cancer Awareness Month, and on October 20th, Friday, we're going to have a Pink Pride Day at White River Health System, and so it's more planning is underway, and so but plan on October 20th to come dressed in your pink and participate with us to recognize Cancer Awareness Month. Finally, our benefits fair at White River Medical Center is October 26th to the 28th. At that time, you'll learn about the benefits that all of us enjoy at the hospital. Approximately 25% of our compensation is tied up in employee benefits. So the hospital or the health system really prides itself in having a full range of health care benefits. And so be sure on October 26th to the 28th at Waverly Medical Center. You come and learn about those, because all of us really are fortunate to have those benefits as a part of our compensation. So October 26th to the 20th, it'll be in the conference center at the hospital. We have a lot of events going on at Waverly Health System, and to get a full list of those things, you can look at our Facebook or our website, WRHSSystem.com, to get a full list of all the different events we have going on within the system. So make available, or that's available for you to look at, and to the extent that there are items of interest, be sure to participate with us. So thanks, and have a great month.